Cholesterol in and of itself is not a bad thing. We all have it and need it in our bodies. But what is it and when does it become a problem for our health? Dr. Charles Metzger of Boca Raton Regional Hospital is here to tell us what we need to know. Thanks so much for joining us.
Thank you.
Let's start with the basics. What is cholesterol?
Well, cholesterol is a substance that we can measure in the blood that we get both through diet, eating certain things, and genetically we can create, our bodies can create it. Typically your liver creates your cholesterol in your body. It does serve a purpose. It creates certain things in your body like cell walls, but at high levels it can be a problem.
So what is the difference between what's considered good cholesterol and bad cholesterol?
Well, good cholesterol is HDL, or high-density lipoproteins, and that actually can help take out some of the bad cholesterol in your body. So having high levels of HDL is a good thing, although it can raise your total measurable cholesterol, and sometimes people get concerned about that. It's about the ratio of your good to your total cholesterol. Bad cholesterol, or low-density lipoproteins, is what can create the issues of narrowing of the arteries and put you at higher risk for certain events like heart attacks and strokes.
Do cholesterol levels run in families?
It definitely can, and there are several reasons for that. Sometimes it's a lack of a certain enzyme that allows you to metabolize cholesterol. And other reasons it's probably much more complex than that, whether it's learned behavior in terms of diet and things, but it definitely can on certain values.
And what about gender? Is it a factor?
Males tend to have lower HDL or lower good cholesterol. They feel that testosterone levels affect that. In fact, people who are bodybuilders or competitive athletes that use anabolic steroids can have very low HDLs. So it's definitely that's a big factor and plays a role in how that is. And we feel like that's a reason why men tend to have heart attacks at a younger age than women.
And what are some things that can cause high cholesterol?
So diet can play a large role. Certainly, as we mentioned, genetic factors or hereditary plays a role. And so we try and have people avoid fatty foods, fried foods. Certainly, any other risk factor for heart disease can play a role in how your cholesterol plays, what risk cholesterol plays in these things.
And at what age should people start looking into their cholesterol and really being concerned with it?
It depends on your own risk factors, but certainly in the early 20s, at least getting a screening fasting lipid profile would make sense, depending on the values and your other risk factors, meaning if you're diabetic, if you have high blood pressure or other risk factors, if you smoke, if you have a family history of risk for heart disease or strokes. You should probably get followed more regularly. But basically it's about being able to be screened, seeing what the values are, and determining with your physician what should happen from there, how often you should be checked, and what goals should be set for your cholesterol.
All right. Thank you so much. Very helpful information. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.